A very good afternoon to one and all. On behalf of IIP Digital team, I, Dr. Uttara Mohan, welcome you to this webinar, Can the Back Pain Be More Than Spinal Issue? The speaker for today is Dr. Richa Singh. We are streaming live on IIP India YouTube channel. I request all to subscribe to this channel to get regular notification during our webinars. You can also view our previous webinars on this YouTube channel. To know about our upcoming webinars and other notification, you can follow IIP on various social media platforms. Today's webinar is being organized by IIP Women's Cell Ujjain District team. The moderator for today is Dr. Deepa Setia, State Sub-Coordinator IIP Women's Cell. Now I request the moderator to please take over.
Thank you, ma'am. Thank you so much. A very warm good afternoon to all. And sorry for delay. There was some technical glitch. Today's topic is, can low back pain be more than a spinal issue? Yes, back pain is a very common musculoskeletal disorder we face in day-to-day life. The point prevalence is about 30%, and almost 50% of adults have at least one episode of LBP in their lifetime. So, to know more about this low back pain, we have Dr. Richa Singh with us. Welcome, ma'am. Good afternoon, ma'am. I would like to introduce you to Dr. Richa Singh, ma'am. Uh, Dr. Richa Singh, ma'am, is an efficient physiotherapist of Bangalore City. She is the IEPWC head of Bangalore district. She has her own setup, very renowned setup. You must be heard about Perfect Bounce, and she has worked with Olympic players. She is a chief dry needling instructor. She has conducted so many workshops in India and abroad also, like Singapore and Philippines. And she has received so many awards for her achievement. Um, I hope everyone will get benefit today out of this session. So, without taking any further delay, ma'am, Richa Singh, ma'am, mic and
Hi.
screen is
Yes.
yours.
Yes, hi. Yeah, thank you so much, Dr. Deepa, Dr. Uttara, for coordinating this event. And yes, Dr. Uttara, can we do the screen share now?
Yes, you can start sharing.
Yeah. Yes. Hi. So today we are like doing that how your feet can affect your spine and back pain. What happened most of the time of whenever like we have any back pain, we always focus on all set of the spinal issues only. Could be cervical, thoracic, and the lumbar. And sometimes we assess the pelvic this thing also, but we never think of that. Their arches can affect the spine, and the way they stand, sit, and everything. All the activities can also affect. So what happened all the time? We try to be focused more on the thinking in and around of the spine. So what I have felt sometimes when we do not get the result, there is chances that there could be some other reasons. And then I figure it out almost 30 to 40% problem. Sometimes it happens because of their feet alignment, the way they stand and everything, all the activities also. That way they are getting the back pain. So there's most of the time when they see X-ray, MRI and all this, okay, my spine is clear, but still they're getting the back pain. And patient also very surprised that if everything is fine, then why I'm still getting the pain? And it's not when painkillers and everything doesn't affect sometimes. Severity is so high. So that was I thought of, and then this topic was quite different. I felt, and then I feel like whenever I treat the patient and all, I get a better result, and also that's what I thought to be choose this one and go ahead with at this perspective too. So as few of us are very much stranger to the lower back pain, like well experience, that's a good thing. And in fact, as many as the 80% of the people have the back pain in some type of their lives. And as physios, we get most of the time the back pain is very common. The first thing when they think of the physiotherapy, they always, as a layman, anybody thinks of their back pain and they comes in the mind, look and should ask and listen. So sometimes the cows be the very much of obvious like any sports activities and the bending in the wrong way and day-to-day activity, something they're doing here and there wrong way. That activities also can affect. And other times, however, the reason might be the surprising, like when the culprit turns out to be your feet and the improper footwear. And that very much of rare people can understand. Even as a physios, we do take time to think of that perspective. So most of the time we just first assess the spine and then we think of any other perspective and all what the activities can be. And how it affects the body exactly, the whole alignment. So definitely when you head to toe, whatever the alignment the way do, all the activities affects one or other joints also too. And as back is always gets involved too much, especially the lower back, because of our whatever standing activity, lying down, walking, running, whatever activity you do, spine is always involved in that. So when we walk, you put the force as much as the 5 times your body weight on each foot. So whole body weight depends upon our feet, the way we walk and all. And the food doesn't absorb that shock or redistribute it properly, you can develop the problems somewhere else too. Not necessarily you'll feel the feet pain first. It might be somewhere else the pain can lead to, but the problem can be from the feet only. And often this occurs in the people who have the flat feet. That is very common to everyone knows. But again, there is a variety of the flat feet again that varies, which people are not aware of. And we do not we think flat feet means fine, that's the congenital, and we'll go ahead with the things, no one can correct it and all. So people sometimes become very offensive to see any orthotic footwear, any arch support to use it. So sometimes there is question, can it correct in long term the flat feet? No, and after a certain age we also know given the whatever the height and person has achieved, we cannot correct the flat feet, but definitely we can prevent the further injuries, and the alignment and all that definitely can correct. So they can again control that all the long term problems what they can feel it to be. So because the arch appears to be like flattened and closer to the ground. So, and another major causes for the back pain is the hypertonation. People have tendency to put more pressure to the medial side, and that is obviously the moment this arch is not developed, there will be tendency to put more to the inversion and the medial side of the arch. And the moment one feet, if you put it more pressure to the medial side, there's chances of you doing the obviously compensatory movement at the hip and the spine. The moment you'll try to deviate your hip alignment, obviously the spine has to move other side, and that causes in long term muscle imbalance in the lower back. And then one side we feel the more stiffened, and also most of the time they complain of the lower back pain, one side they get more. And the side which most of the time they feel in the left side, because right is quite active side, and so they do not feel the complaint of their tendency to put more pressure to the shift of the body weight is more to the left side. So these are the types of things can happen, and where the alignment is the main reason over there. So here in this image, you can see the more of medially rotation, how this alignment changes from the ankle only. So obviously the knee, hip, everything will get affected, and the spine also has to sit one side. So neutral alignment is very few. We get hardly when I start observing the people, hardly I believe not even 30% of population who is keeping the alignment straight in any way. Especially I believe the military personnel and the where they have to maintain the discipline, and they are aware of their posture. They only maintain their better distinct posture compared than the other whatever the corporate sector and day-to-day activity, whoever we come across, housewife or anybody, they hardly maintain their posture in activities, and that in long term leads to the back pain and any other issues over there surrounding. So causes for the back pain. Again, the pronation refers to the inward motions of the foot, which results in the collapsed arches and the flat feet when you stand, walk, or run. Any activity what you do, that will develop. And this should be mild pronation with walking and running. And it's a necessary motion that allows for the dynamic action of the foot and the ankle to reduce impacts on the body and walking and the run. So the problem arises when there is excessive or the overpronation or the hyperpronation. So anything can lead to be. There could be could be medially more putting pressure, or the right side, opposite side putting more pressure, that can be lead to be. So all these things definitely we sometimes we don't even think of that perspective, and we just assess the back and we move on with the what the treatment plan we can go ahead. And that's what sometimes our plan says, because the thing which we have to focus, we could not just think of that perspective. And the pronated feet and the back pain, again like more of inversion mentally, and the excessive inward motion of the foot that accompanies hyperpronation is causing to the leg to turn inward, as well as affecting the knee, hip, and the lower back posture. So all the alignment issues can be happen. So one alignment, the moment angle deviation will be there at one spot, so everywhere can happen. So this might be compounded when excessive foot pronation occurs only on one feet, And since when that foot pronates, it shortens the effective length of the leg, the distance between the hip and the floor. That changes. So both the leg, discrimination happens, and that is alignment varies. And when they walking or standing or running anything activity, they're not putting as much of pressure and as much of distance in between both the hips should be there. And that was over the time period. This is not a day they will analyze. Once they start getting the pain, and then they think, okay, then once we assess, then we can tell them, aware about their body. Okay, this is the things what they're doing the wrong pattern. And additionally, because of the excessive foot motion, the muscles on the inside of your leg must work harder to the pull your foot up on this thing, because obviously one side is getting compromised the activity, so other feet has to work more functional. So that is become problem is not for the only one leg. Can think if one feet is the flat feet or any arch issue, that is acquired arch issue, then why the other leg also need the support? What happened? Definitely, the moment this leg is getting compromised activity, the other leg has to do the more activity. Body has the tendency to do the compensatory movement all the time to continue with the activities. So that is we have to correct both. So that is that other normal feet also do get compromised with the muscles strength and everything. And sometimes people have the both the feet flat feet. Not necessarily every time it will be one or the both. So all the there is very different varieties are there. So we should always think of this can be congenital or is it more of acquired one. So both the perspective then we can correct with that. Another foot problem is the hypersupination. Again, more of outward side reporting the weight, and that can lead to be the inner side of the knee pain in the long term, and where the feet are rolled outward with what seems to be a high arch, and hypersupination causes also outward rotation of the leg and the extra stress to the muscles on the outside of the leg. So obviously, the hip muscles will be comparatively weaker in this one, and that reason gradually it will become compensatory movement on the spine. And so that's why spine has to again the more of in this condition people might can get low back pain exactly at the center more compared than the any side ones. And either hyperpronation or the supination also can lead to the problems in the hip and lower back, both of the thing. And when you experience pain and you are diagnosed with a dysfunction of the foot function, using proper orthotic footwears and the insoles can help in that direction. So sometimes when we plan the treatment, we think of exactly in and around the spine, and we plan whatever the treatment we have to do to control the pain. But what happens that patient or the person keep getting that pain again and again recurrence. The reason behind it is recurrence happens because of that pain is because we are not uh, seeing looking after the what can be the long term solution for them. So whenever we assessing the low back, I'll suggest definitely we should assess the feet and all the arches also, so that we can give them the long term solution. So that helps a lot when they correct their the way they stand, walk, and all these activities. That will help them to not to get this pain again and again. So that body has to learn to go ahead with the thing and correct it again. So we can control the pain, that will be temporary relief. But long term, again recurrence to control that, definitely we have to look into the foot arches and correct that also, and advise the patient to be do the rest of the exercises too, to not to get this again and again, and on the routine. So total body alignment starts with your feet. So this you can see as a in the image over there. The moment like around one place, like more of inward motion, everywhere the angle changes. So that will just affect the shoulder. Many times people comes with the shoulder pain also and the neck pain, and I see something with the arches and then correct, and then in the long term that gets rectified. So and even sometimes initially might be the patient will get surprised why doctor is assessing the feet if I have the neck pain or the shoulder pain. But definitely the back pain is whenever it comes to the spine, any portion can be the upper back, mid back, or the lower back. But definitely we should think of the and see the perspective of the feet arches very much of important, and all the alignments, pressure points, and everything. And based on that, you can see if you can rectify that, it can give the better result over there. And heels and the back pain. So females are very prone to using the heels, and that is the major cause for the males to get in any age group generally. And the Spine Health Institute has found that almost around 72% of the women wear the high heels, and however, unfortunately, high heels are an extremely common cause of the back pain in the females. And you may enjoy the opportunity to pick out a new pair any heel with an angle greater than an inch can cause countless problems in the body. But yeah, in short term, we can use that one. That is nothing wrong in that for few hours to using. But yeah, it's very much of on routine. If long term, definitely everybody should without pain also should do daily routine exercises to at least calf release and also immediately, so that you at least can start doing the compensative, so your body doesn't get used to that pattern, and that muscle won't get fatigue in the long term. You and heels, high heels not only affect the spine, they negatively impact the feet, knees, and hips too. All the alignment goes wrong with that. And this is because wearing the high heels shifts the body weight forward onto the walls of the feet, and adding pressure to the bones and the joints. Okay, so almost it's like 20-80 ratio it goes. Otherwise, normally if we're using the normal footwear, the normal arch, then it goes 50-50, like front and the forefoot both, like heel and the forefoot. But the moment we go like a higher angle, as higher inches we're using that for the heels, it causes more pressure on the forefoot over there. And adding heels also like restrict the range of the movement and in the foot, and can lead to the foot problems such as the bunions and toenails and the hammer-toe deformities. These are also the long term when we use the very much of pointed shoes or something into regular routine. So we should keep switching at least shoes in the different categories. So if we occasionally wearing, that's fine, but try to be as much as open on the front side also, not the conical and pointed one. So that will help to be as much as comfortable. Wearing the heels regularly may also shorten the and tighten the calf muscles, making it difficult to extend the leg and causing the quadriceps to work over time. And this puts a phenomenal amount of stress on the knee joints and can pull up the kneecaps out of the alignment too. Obviously, because as much of pressure it goes, the socket and everything will be down, and whole alignment put more pressure to the front side and all. So that was it goes wrongly. And the kneecaps aren't the only joints that are the forced out of the alignment from the wearing those heels. The hips have a fundamental role in any leg movements, running, walking, etc., whatever we do. And it's like obviously continuous movement. So that time joints and the muscle doesn't get enough time to ease out. And that time we start realizing pain fatigueness will increase, and later on after the activity we feel more pain, and the recovery slows down. So pushing them out of the alignment by wearing the heels can cause the pain in the associated leg muscles, such as the adductor, hamstring, and the glutes, all the surrounding muscles. So even whenever the low back pain, not necessarily only the back muscles are stiff or the muscle imbalance is there. There could be the surrounding muscles. So these are the reasons to be causes. The moment if you see the arch, you'll get to know all the muscles which can cause the tightness and stiffness, where all other possible areas can have the stiffness. So on the top of this, wearing the high heels pushes your chest and the pelvis forward, and this unnatural posture further contributes to the pain in the lower back. Because what happened, the thoracic and the thoracic area is more of supported with the rib cage, rib cage. But at the lower back, hardly that L1 to L5 is like totally like whatever the weight gain, everything happen if forward COG will lie more front side. The whole load comes to the lumbar spine and everything. So that's what we get low back pain more like common we see than the more of mid back pain and everything. Mid back pain also, all the alignment changes at the mid back to the thoracic region too, but we do not feel much at the thoracic because it's supported with the rib cage. So direct pain very few people feel. Compare than the low back complaint comes much more higher side. So again, the posture further contributes to the pain in the lower back, and wearing the highs continuously can cause the chronic back soreness, spasms, and can even lead to the arthritis in the long term. Low arch, how we can see the arches. So this is the mainly the low arch, medium, and the high arch. So medium arch is a conventionally normal pressure and everything goes. So and again the high arch. So there's again the force pressure points and all the contribution will be different. And in the low arch, definitely flat fit, there'll be no compensatory movement. So that's the all the alignment changes. It's like more of medial side deviation. Even kneecap rotates medially. So all this can cause us to the pain in the long term. So these are the things to try to be as much as we can correct these alignments over here. So that will help to be, it's like flat fit, definitely you can see the arch is totally like this gap over there. So that way it can lead to be the more further problem to the alignment difference and all. This is quite natural arch, medium arch should be always there. So this way we can, put more pressure on the 90-degree angle it goes, and further we do not have the deviation much over here. And high arch again put more of the outward direction we push. So this is more of the supination we get. And that way it leads to the pain again in the more of the central back over there. So these are the things we can always try to use in the our practical this thing practice also whenever the patient visits. So you whatever the problem they come with, definitely assess the feet. So that way we can rectify better way that their back problems and all. And how to prevent this damage exactly. So where there is less often as much as can prevent for the females and this thing and alternate wearing the heels with wearing the flats to reduce the amount of time you spend wearing the heels. And the height of your heels will determine how much weight and the pressure you put on the forefoot over there. And the obvious solution is as much as you can avoid that one to wearing it. And in posture and the foot analysis. So how we correct this thing? So you can see in this image that you can correct posture and correct posture how it goes over there. So that way the in posture analysis you should look at the your static posture to see if there is any imbalance and that may or may not cause the pain and discomfort. So check how well your muscles and the joints work together and check for any imbalances that can be corrected. It is explored how your body moves over there. And during an analysis and evaluation, the whole body is generally looked at from the different angles. So generally anterior, posterior, and the lateral are observed in the three aspects. So we have to definitely look all the perspective. That way you can go ahead to check the alignment. Obviously laterally we also see posterior and anterior, all the possible directions. So that way you can correct it. And so whatever the foot analysis is used to assess the treat individually with the conditions affecting their ability to walk. And definitely whoever has the back pain, they will say whatever the day-to-day activity they'll have the discomfort and the complaint of pain and on and off in the different activities. So if you see the feet is definitely all these things. This is the flat feet and flat foot, low arch. So if you see lateral view and the complete feet if the posterior view, and you can see this alignment deviation. So the moment this arch is both is goes medially and inversion position, so there will be alignment difference at the knee, hip, and the low back too. Again, the null for the medium arch. This is the correct posture how it should be aligned. So, and this sign you see many people have the like T tightness too. So definitely back pain is fine. They come with the low back pain or the mid back pain. But most of the time, if you assess the same time, you'll see they'll be like T tightness commonly. So most of the time, patient doesn't come with direct T tightness, but they haven't even realized over the time period this already has tightened. And they haven't felt also the any difference. So try to ease out all the muscles to get the better result. And this is again the hollow, foot high arch. So in high arch again is like more of goes, outward direction. So then also the hip alignment differences, and again the spine has to get compromised in the movement over there. So analysis can be done with from posture boards, any symmetry can use it, and special rulers if you can, or wooden blocks of the different heights, tape measures, cameras, references, range images fixed to the wall. So see what is the best principle you can utilize it to correct it. And develop special softwares are also there available, and the medial imaging devices such as the medial imaging devices equipment is also used. And so there are many softwares also which can help to process, or direct manually also you can assess the fit, and then you can go ahead with the treatment plan. And certain areas of the body are marked with the stickers for the detailed analysis of the faulty or the abnormal postures. And the software pictures out all the possible faults and the unequal weight distributions or overuse of the particular joint, and creates a final posture analysis report. So that is you can get to know how it helps, and that way you can correct the back and over here. Prevention. So obviously correct sitting posture and choose the proper foot cares and do back and the foot strengthening exercises. Avoid long hours of sitting. So we got patient complaint with the back pain and also we do suggest. And definitely as a foot arch is very much important. So definitely correct the foot arch also definitely would. And the strengthening exercises for the feet was also very much important to correct this angle. So that is as much as muscles will ease out and the movement will be free, because most of the time I have noticed when the patient with the back pain also there is a compromised feet movement also there. And it's hardly like it's kind of immobile. They're not very flexible. The whole arch they're moving, but they do not feel at all because no one focuses on the feet much over there. There's more concentration on the low back pain. So that's what that as much as they start using a more proper orthopedic footwear guidance you can give them. So that will help a lot. At the same time, strengthen exercises for the feet and all the surrounding muscles also definitely equally important whenever we are treating the back also. Okay, thank you everyone. And if any question and queries, you can ask the questions over here.
Anyone have the question? If anyone have any question, you can drop in message box or chat box. No, I guess no one has any question. Thank you, ma'am. Thank you so much. On the behalf of IAP Ujjain WC, I would like to thank you for this informative session and you took out the time for us. Thank you so
Yeah.
much. And I would like to thank also technical team. After all these glitches, they have exist. Last but not the least, all participants, thank you so much for coming and joining us. So that is for today. We will meet again with the new session. Thank you so much.
Thank you, Dr. Rupa and Dr. Suman for the coordinating this event and whole team, your IIT team, and definitely the participants. And definitely try to implement as this thing, so definitely get a much better result. And because we always think of the spine surrounding and we never focus on the more of the arches and all stuff. So as much as any further any queries or any help you regarding, you can contact me directly. And definitely help you out.
Sure.
Thank you. Thank you, everyone.
Thank you so much. Now participants can leave the meeting. Thank you.